Fourth exam question. Let me read the question out clearly. So they said, write short notes on the following. First, you should talk about prevention of hypothermia in newborns. So hypothermia is like low body temperatures in newborns. You should talk about what? Kangaroo mother care in newborns. Okay, you should talk about sepsis screening in newborns. So, it's just an exam, so they cannot just put so many small concepts in one question, okay, to make up the complete marks and all of that. So we'll talk about all of them. So the first one, which is prevention of hypothermia in newborns, basically you're trying to prevent what? Low body temperatures in somebody that you just gave birth to the person of recent. So as a way of introduction, you should know that newborns lose heat rapidly because their large surface area related to body weight and limited ability to shiver. When you are shivering, your body is actually generating heat, but newborns don't shiver. Okay, so different ways you can actually reduce their body temperatures going down is immediate drying after birth. So you have to dry the baby, okay, to remove the amniotic fluid around them. Skin to skin contact with the mother, that forms the basis for kangaroo mother care. You can see how the concepts are relating. Early initiation of breastfeeding to provide energy and warmth. So warm environment, the delivery room, they usually off the fans and all of that. At least the temperature should be more than 25 degrees Celsius. Appropriate clothing and wrapping. So before delivery, the mother always buys all those caps, socks, blankets and all of that. So avoid unnecessary separation from the mother. Okay, so always leave them with their mother. So use of radiance warmers or incubators, okay, for sometimes for babies that were born before time. Okay, so kangaroo mother care, now let's talk about it. So they usually abbreviate as KMC. So anytime you see any pediatrician or obstetrician talking about KMC, is a kangaroo mother care. So it's a method of caring for low birth weight or preterm infants. Okay, and this care is through skin to skin, continuous skin to skin contact with their mother. So first of all, the baby is placed upright between the mother's breasts. Okay, so kangaroo mother care also entails exclusive breastfeeding, where you promote nutrition and bonding. Okay, early discharge will follow up. So once the baby is stable, discharge them to go back to the comfort of their homes. Okay, and just keep monitoring and following up that the mother is practicing this. So family involvement, fathers and relatives can also provide KMC. Yeah, it's just all about placing the baby skin to skin with you. Benefits is it maintains thermoregulation, so it prevents the baby from losing heat. It promotes weight gain and growth, reduce risks of infection, enhance bonding and breastfeeding success, decrease neonatal mortality. Now, sepsis screening in newborns. Now, because neonatal sepsis can be subtle, screening involves clinical suspicion plus laboratory test. So you have to clinically see some things that will make you want to suspect. Then, okay. So clinical suspicion include you are seeing that the baby is poor feeding. Okay, the temperatures are low. Okay, lethargy, irritability, respiratory distress. Then you do blood culture. You are doing blood culture because you want to actually identify the microorganism that is causing such issues. Okay, then complete blood count, where you are trying to check out for what? Leukocytosis, leukopenia, or low platelet levels. You also do C-reactive protein and procalcitonin. So all those ones are markers for infection, so you want to actually confirm that there's an infection. Then peripheral smears, okay, lumbar punctures, okay, to see if the meninges actually involved in the spread of the infection. Chest x-rays if the baby is having difficulties in breathing. Then urine cultures, okay, just to still identify the microorganism that is causing such issues.